Good morning, everyone. The next meeting of the Board of Health will be held on Friday, March 4th, 2022 at 8 a.m. in the Selectmen's Meeting Room at the Richard D. Carney Municipal Office Building located at 100 Maple Avenue, Shrewsbury, Massachusetts, 01545, at which time and place the Board of Health will consider the following agenda. So I'd like to call the meeting to order. The first item on the agenda is review and act on rescinding and making an effective date for the executive order to require face coverings in all schools, public, private, parochial, and charter, K through 12.
Mr. Chair,
Dr. Abraham?
as you pointed out at the last meeting, we had discussed today being a date when we would review the data. Since that meeting and till to date, I've had an occasion to review the data, both the positivity rate for the county as well as the data from the wastewater sampling which occurs in the Upper Blackstone Valley. And both of them show consistently low levels with no evidence of surges. So I'd like to make a motion to rescind the mask mandate in schools effective immediately.
I'll second that.
Thank you, Dr. Abraham. I agree with your assessment, based on the data and the information provided by Dr. Hirsch 2 weeks ago and all of the public health agencies. It seems like it's about the right time. So let me do it this way. Do we have a motion to rescind the executive order to require face coverings in all schools, public, private, parochial, and charter, K through 12, effective immediately?
Yes, Mr. Chair, motion.
I'll second.
All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. Okay, so the mask order is rescinded.
I would just like to comment. I was able to hear Dr. Sawyer's plan for going forward with metrics and everything, and I think that's a great plan. It was good to hear that, building on what we've learned already in terms of seeing if there's any spikes in the school. I thought that was great.
Thank you. May I make a comment, please? I'm not sure I can be heard from here. I'll just come to the table if that's okay. I'm just asking you if you can help me understand why there was no discussion of the correspondence that I sent to you last evening, requesting in terms of the timing and the effective date and what your rationale is. I find it curious that I've never heard of the Board of Health changing a rule for businesses in the middle of a business day or for a hospital in the middle of a hospital day. This does create a tricky situation for us, which we will manage. But it's yet one more tricky situation that we need to manage, which could have easily been avoided. So I really wish it would have been at least acknowledged and discussed before taking your vote. Thank you.
Mr. Chair,
Dr. Abraham?
may I respond? So I think the mandate to this board was to consider the rescission of the mask mandate based on the available evidence and data, and that's what this board makes. Operationalizing it is a different issue, and I respect Dr. Sawyer's position, and we are happy to discuss how we operationalize it. But operationalizing it is very different from taking a decision on the science and evidence. This board received a fair degree of commentary after our last decision with varying degrees of civility, which questioned our competence and our evaluating the data. I have to respectfully state that this board has a seasoned board member as chair, an epidemiologist who, in her daily job, evaluates data and makes decisions based on data, and a physician who's a board-certified infectious disease physician, is on a national writing task force which writes publications on COVID-19, has managed a hospital during an entire pandemic from the day that COVID-19 was first recognized in the Commonwealth, and continues to be supported as a board with two outstanding public health professionals, Director Clark as the director of the Worcester Department of Public Health, as well as the Central Mass Regional Public Health Alliance, and Dr. Michael Hirsch as medical director, who worked tirelessly day in and day out, night and day, to be able to evaluate the data. So this board, together with the Central Mass Regional Public Health Alliance, evaluated the data and made the informed decision, to the best of our judgment, based on data that is available, to rescind the mask mandate for the public, but felt that given our history of having surges every time after a school vacation break, decided to delay the decision around schools to a week after. And so our mandate was really to evaluate the data and make an informed decision. Grateful to both Drs. Hirsch and Ms. Clark who provided us the data, which we were able to look at, and I personally was able to look at. And so we made the recommendation. I understand that operationalizing it is a bit of a challenge, and I take Dr. Sawyer's point respectfully and agree, and we're happy to work with him to figure out a way to operationalize it. But on principle, our mandate was strictly to evaluate the data and make a decision, and that's why we did what we did.
Thank you, Dr. Abraham. Any comments, Jenny?
I mean, in terms of operationalizing it, can we make a date and time that it's actually effective?
Well, we just
Did we
made
do it
effective.
immediately?
Yes.
Okay.
So that can't be changed. Okay. Okay, so the next item on the agenda is to review and discuss the executive order to require employers to report COVID-19 cases in the workplace. Karen, do you have any comment on that one?
Sure, thank you. So this is a emergency regulation that the board had put into place, and also the Worcester Board of Health did as well, in terms of alliance communities that went forward with this. And I think it's really important to leave this in place. At one point, under the governor's executive orders, it was required for businesses to let local boards of health know if they had any employees that were positive, so that we could ensure that we were doing proper contact tracing and providing information and resources. But when those executive orders for the governor, under the governor, were rescinded, that piece went away. So that's why we had put this in place. You know, there still is some degree of virus out there. We know that even from a college community that had 75 cases last week, which was, this is, you know, 100% vaccinated college. So just as an example, it can and will happen. So I think, you know, we still just want to be able to get that information so that we can do our due diligence and follow up and make sure that we're doing proper contact tracing and just sort of understand really on the ground level what's going on out in the community. So I would respectfully request the board leaves this one in place. I don't have an exact time frame because none of this has been a blueprint that has been really designed and followed before. So I would just ask if we could just leave it and revisit it at a future Board of Health meeting.
Mr. Chair, may I make a
Okay,
comment?
yes, Dr.
So I'd like to second Ms. Clark's suggestion. She's right on. One of the challenges which we have encountered most recently, which is appropriately so, that the access to testing is increased with home-based testing, but unfortunately that testing and the results don't get recorded in any sort of a system, so we feel that we may be underrepresenting or undercounting our prevalence of the disease. So to Ms. Clark's point, by some sort of a reporting mechanism, we continue to be able to at least track and have some handle on the trends of data so as to be able to make informed decisions when there is a surge before it becomes a catastrophe. So I'm completely supportive of Ms. Clark's suggestion.
Okay, thank you, Dr. Abraham. I would tend to agree with your assessment. Any more comment, Jenny?
No, I would agree with it. I mean, I think it's not necessarily time to take all of the
Yeah.
measures away at this point.
Exactly.
We are still in this, so I would agree.
Okay, so I think we can just leave it at that. We're not taking a vote to rescind anything, so
Right.
we'll just leave it at that.
Correct.
Okay, the next item on the agenda is to review and approve the minutes from the February 15th, 2022 Board of Health meeting. Do I have a motion?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So the minutes are approved. The next item on the agenda is review and discuss the Central Mass Regional Public Health Alliance updates.
Sure, I can talk about that. There's really not much has changed since the last meeting. Restaurants are still struggling with a lot of staffing turnover and inability to hire people, so I'll just keep a close eye on how things change as things get back to normal. But other than that, everything has been fairly calm.
That's
Okay?
good.
Yeah,
I like
absolutely.
that.
That's a nice change.
Yeah, it's been different since about the last month. So
Right.
yeah.
Mr. Chairman, do you mind if I just add a few things?
Sure, go ahead.
Thank you for all the work that you and Julie are doing, because I know you guys are crazy busy, and it's been an interesting ride. So just a few things from my end. I just wanted to let you know that Pat Bruckman, our longtime Chief of Public Health Nursing, is retiring next Friday. It's also her birthday, so I think that's a good day for her. And we're having a celebration for her at Mead Street, which everyone's invited to, but obviously I know people are working and may not be able to get out to the city. So certainly, you know, if you want to send her a card or a note or something, we can get it to her if you want to just send it or whatever, or you can send her an email. She's still on deck until next Friday. So Pat's been with us as long as me, 22 years.
Wow.
And has just been an incredible leader throughout the pandemic. And she literally did work 7 days a week and with a sick husband at home. So we're really grateful for her service. And I think I heard a rumor that Mayor Petty might be coming over to visit and giving her a key to the city for her service and her leadership during the pandemic. So I just wanted to publicly acknowledge Pat, because I know a lot of you have a good relationship with her and appreciate the work that she's done for the Alliance. And then just a few other things, a few other little things that we're working on. So the new chip is out. It came out in the Community Health Improvement Plan that Shrewsbury's a part of, came out in October, but then we went into the surge and it just got buried. So we're reconstituting it. We're working with some community partners and also with Matt Moore, who's our wonderful new communications specialist, on how to do that. And so I'm going to request that myself and a few other folks from my team and maybe someone else from the community comes to a future meeting, near future, to just talk about it and step everyone through it and what does it mean and how can the board support the new plan, because it's a new 5-year plan, which will be our blueprint on improving health. And excuse me, some other projects that we have going on is we hired a consultant who you may remember, Zach Dyer, who was our former deputy director at DPH for a number of years, who left us to go on to get an MD, PhD over at UMass. So I don't know when he sleeps, but he's agreed to take this project on. So essentially, he has a consulting business called Trendline, and he and another individual, they do a lot of consulting around community health assessments, community health improvement plans, pretty much all things public health. But one of the things that he bid on for a project was to do a business plan for the Alliance, which is something we've wanted to do for years, but you know, we got derailed by a 2-year pandemic, and just take your pick, you know, anything that happens, it sort of pushes these really important things to the side. So in order to do this business plan in cost analysis, because we've been doing this now 12 years and we're still operating off of the same kind of calculation, but our responsibilities and level of skill that staff need to be able to do this just keeps going like this. So we really want to take a step back and have Zach really dig into this, but also really understand how people feel about the Alliance, how do they feel about the services that are being delivered, what are the gaps, what are the challenges, what are the successes, and how do we capitalize on that. So Zach has been meeting with chairs of boards of health in the Alliance and also with town management to just sort of, he has, you know, some questions that he's asking a facilitated guide. And while he's doing that, he's also assisting us in becoming reaccredited. So we became the first accredited health department in Massachusetts as a regional district in 2016, even before the state did, or Boston, which still doesn't get old, even though it's 7 years old, saying those bragging rights, but it's still pretty amazing. We've had to delay reaccreditation twice because of the pandemic. Nonetheless, you have to have a current community health assessment, community health improvement plan, check, check. So we did all of that, but now we need a strategic plan and a workforce development plan. You have to have all of these things lined up before you even reapply. So Zach is meeting with, we're gonna have a half-day staff retreat. We're gonna have a whole bunch of different exercises. We're gonna be talking with community. A lot of the information that Zach is pulling from the key informant interviews for the business plan, he can use those as well to help inform the strategic plan. So he has quite a bit of work he's doing. Colleen and I have been meeting with Zach once or twice a week just to get, there's a lot of documentation, there's a lot of stuff that has to be done. So our hope is we'll be able to reapply for reaccreditation for probably over the summer, I think, if that's right. So a lot of moving parts, but it's nice to actually get into these projects that are so important, that really help the way that and shape the way that we deliver public health services and how we work with the Alliance, and get that direct feedback from the people that are receiving the services or that we work with to be able to inform all of the work that we're doing. So yeah, just a few little projects going on, but anything to talk about something other than COVID, we are okay
Isn't it nice
with.
to work on something other
It
than
really
the
is.
pandemic?
It really is. So that's kind of what's going on. And I just want to, I mean, I've really only talked with you on the phone for months, but I just really want to personally and professionally thank all of you and my team and Kerry and Kristen and Kevin. This has been such an unbelievable experience over the last 2 years. Obviously, we can't totally put a period at the end of the sentence because we just don't know about new variants, but you know, to Dr. Abraham's point, he so eloquently said the levels of civility, which I appreciate you putting it that way. The level of abuse, not only that Kerry has taken, myself, Dr. Hirsch, you folks, it's not just contained to Shrewsbury. We get hate mail on a consistent basis in Worcester, and I know many of my colleagues at the State Department of Public Health and across the Commonwealth and frankly across the country have left their positions over this kind of discourse. You know, we understand the frustration. I just publicly want to say nobody wants to wear a mask or have their children wear a mask more than we do. We're all tired of it. But I think public health has been completely called into question around our authority, why we do what we do. There's been a lot of politics involved in this, and it's really made it challenging to do our work. And I feel strongly that the our credibility has been damaged, quite frankly, because of constant changes at the federal level and the state level. So not really saying anything you don't already know, but I feel really strongly, especially after the emails and calls that we've had to deal with directly, that it really needs to be said that I appreciate your strength and resilience, because that helps us who are in it literally day to day, 7 days a week. And just want to thank you for your leadership and support, because there's no way that any of us would have been able to get through this. So just know that I'm grateful and want to express that on behalf of my team as well.
Thank you, Karen, for your comments, and we really appreciate all of your support and help in that of the Worcester Division of Public Health. I mean, it's been an invaluable resource to us and a lot of strength to us, so thank you so much.
Thanks, Steve.
Okay, any other comments?
Mr. Chair, just like to place for the record our gratitude to Ms. Brackman for her service to the Commonwealth as well as to the Worcester County and especially to Shrewsbury, and so that we appreciate all her services and wish her well in her retirement.
I second that thought, Dr. Abraham, and I've met with Pat many times, helping develop our emergency plan and so forth, so she's really has been a very valuable resource.
I
Thank
will
you.
certainly pass that along to Pat. Thank you very much.
Thank you.
I want to express my gratitude too. It's been, it's been a thing. And I think keeping diplomacy and civility maintaining that in the face of some of the commentary has been a definite challenge. And I appreciate, Carrie, your office, and Kristen, your office as well. I mean, it's definitely been a challenge.
Yeah.
And, I actually have some concerns about the kids, because there are kids that are going to want to still wear their masks. I've talked to parents whose kids have voluntarily said, I'm not ready to take it off. And I just hope that the vitriol of some of those parents does not filter down.
Well, nobody should be mask shamed. We don't
Right.
know why someone might want to continue, but certainly, I think it needs to be said, we fully support anyone who wants to continue to wear the mask, especially children or parents that make that decision. So,
Yeah.
I think that's important to note. Thank you, Jenny.
Okay, so let's move on to, the next item is to review our meeting schedule. So that puts us into April.
Oh my God, can you believe it? It's going to be daylight
I am,
savings, like,
that
next
is
week.
exciting.
April 15th, which is not tax day this year.
No, it's not?
No, it's the 18th.
Yeah, that's lovely. And it's Easter, too. Yeah, the 15th looks good.
Fine with me.
Does that work for you, Dr. Abraham?
Yes, thank you.
Oh,
Thank you.
okay, great,
Yes.
thank you. Okay, so let's plan on April 15th at 8 a.m.
Sure.
And would that be an opportunity to hear more about the CHIP plan?
Yes, actually, yeah.
That'd be
That's good,
awesome.
because then I can get it on other people's calendars to come to. We're gonna probably need like a half an hour. Which I know is usually like the total time of your meeting, but it's involved. So we have to like spend some time explaining the process and what it is, and I think some specific asks of the board, or at least sort of like what your role could be with some of these things, because it's a lot different than the other CHIP.
Oh, okay.
Can
It's
we
a lot
dedicate that
different.
meeting to
Yeah.
it with just, allowing for updates as well, but just.
Exactly. I was gonna-
Pretty
focus
much,
on
pretty much, yeah.
Yeah.
Think the same, exactly. We can defer other, if non-urgent stuff, and this is.
Thank you,
priority.
I
That'd be
appreciate
great.
it.
Sure, because that's very important to
Great.
us.
Agreed.
So it's April 15th at this time, or?
8.
8.
Okay. Great, thank you for that opportunity, I appreciate it.
Okay, in that case, do I have a motion to adjourn?
So moved?
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. Meeting is now adjourned.
Thank you.
Thank you, everyone.
Thank you.